This is great. Okay, so tell tell me whenever you're ready, and we'll hit the record button.
Okay, hang on just one sec. Okay, let's do it.
Excellent. All right, Congressman Dejarlais, thank you for taking a few minutes out of your busy schedule to chat with me. Obviously, you have heard the news, and you put out a statement about the closure of the McMinnville VA clinic. And I just wanted to know your thoughts on this. And I guess, when did you first hear that the VA clinic was closing?
I think I probably heard when you did. It was one of those things that came as a total surprise to us. We had no prior warning, no notification from the VA. And so I think when the clinic announced that they were closing in May, word spread and it got back to me. And so I immediately fired off a text message to Secretary Collins. He was a former member from Georgia, Doug Collins. We were friends at the time before he left to do this job, and I thought, we need an answer to what's going on here. He had an undersecretary call me pretty expediently, and I asked what was going on, and that people are pretty upset about this, understandably, and what we could do about it. And he said, "You're 100% correct. We should have reached out to you." But to my knowledge, he didn't reach out to any state, local. I think the county mayor said he didn't know about it. So it came as kind of a shock to everyone.
So, since this announcement, what have you been hearing from the U.S. Department of Veterans Affairs or others involved about what's happening?
Well, we're waiting on some answers. As you know, I sent a letter, which you've probably seen, asking several questions about, you know, what other opportunities do we have? And had we had knowledge of this, perhaps we could have found some type of a solution to restaff this clinic. As you probably know, this clinic's been around for probably 16 years, and the current contract is not with VA employees. It's just local contractors. And from what I gathered from the conversation with the undersecretary was that they were somehow not happy with the way it was operating, and that they were going to cancel the contract as of May and try to find other solutions for the veterans. I think people, he said, in eastern Warren County would be closer to Cookeville, which, according to him, is 35 minutes. People more western Warren County would be directed towards Tullahoma. Again, hopefully, 25, 30 minutes. It seems like it's a little longer than that to me from downtown McMinnville. But then ultimately, they were looking at some type of a public-private clinic that could open in 27 in Manchester, which would be, probably 25 minutes from McMinnville. But that's not the ultimate solution in my mind. I would like to see this clinic restaffed, and we're going to push in that direction. I've not had a direct conversation with Secretary Collins yet to see whether this is something that is mandated. There's over 13,000 of these, or 1,300 of these clinics around the country. I think 170 full VA hospitals, and so obviously he has a lot on his plate. But I don't know why this particular one was targeted, other than it sounded like they were not happy with the current contractors.
Right. So what are you hearing from veterans in your district?
Well, a lot of them are concerned because it's hard to, especially for elderly, to travel long distances. It's quite a ways to Murfreesboro. Um, they certainly would like to keep the clinic where it's at. And most importantly, they want to have access to timely health care. With the VA, sometimes that's been a problem. In 2018, we passed a law that said that if they can't get a veteran in a timely fashion, that they could utilize private facilities or other specialty care. When I had my medical practice in Marion County, I was a TRICARE provider, so took care of a lot of veterans. And I would urge veterans to call their VA contact, because there's a community cares uh, program in place that they could qualify for, where they can get approved and use local physicians, which would certainly be convenient. I know the veterans that came to me appreciated having that access. and they can also see what other options are available. If there's all different kinds of TRICARE depending on your years of service. If it's over 20 years, I think you can go to local physicians. If it's less than that, there's different criteria, sometimes involving copays. So, I would encourage veterans to reach out and ask. You probably go online too to see what your healthcare options are in the meantime. It sounds like this clinic is going to close sometime in May. We'll do everything we can to try to get that changed. If it doesn't, though, it sounds like Cookeville or Tullahoma will be an option until they open this apparently public-private type clinic in Manchester. But that's what the VA undersecretary is telling me at this time. I've not gotten answers back from the ag or the VA secretary directly to the questions in my letter. And I hope to hear from him. Actually, yesterday I was a little bit surprised. So we're going to keep the pressure on them and try to get as much information out to the veterans as we can. But there are other options that you can use besides the VA. You just have to get things prior approved. So I advise that they call and find out what the details are.
Yeah, so that was actually my next question: is what are those other options that our veterans can use?
Well, like the Community Cares program, if they qualify for that, they can use local physicians. If there's TRICARE approved providers in the area, they can use that. So they can look to see or call a physician's office to see if they accept TRICARE, depending on what kind of TRICARE they have. Again, there's multiple different kinds depending on your length of service. And then again, right now, continue to use this clinic, I guess, for the next couple months, and hopefully by May we'll have a better solution. But you might want to look at your travel distance to Cookeville or Tullahoma and see whether those work for you. If it's not a terrible drive, then that might be a solution at least in the short term.
So I'm hearing from we own a pharmacy too, and I'm hearing that the Cookville Clinic is very busy, and sometimes it's hard to get in. Is That's what we're hearing, but obviously I haven't seen that myself. But have you heard anything like that?
I've actually heard that about Tullahoma, and I had not heard that about Cookville, but it doesn't surprise me. It's interesting. My mother was a VA nurse for 44 years, and my first job as a physician was at a VA hospital in South Dakota before I moved to Tennessee in '93. And I felt like we did a pretty good job in terms of punctuality, but wait times I know in Murfreesboro and other places can be quite lengthy. And so, I mean, a lot of veterans would just pack their lunch and plan on spending the day when they came to the VA. And so, that's unfortunate. We should do better for our veterans. And honestly, I don't understand why veterans can't use public health care. The VAs, some of them are great, and a lot of people love their VAs, but I think veterans ought to be able to access local physicians, and that's something that I'm in favor of personally.
Well, and you being a physician yourself, I think I read that you practiced in a VA at some point.
Right. Yeah. My first job was VA at Fort Meade, South Dakota, and really enjoyed my time there, and then moved to join a practice here in Tennessee in '93.
Well, so our veterans, they obviously deserve the best care. Can you explain why we have a VA and why the veterans have a separate hospital or
Well,
clinics?
that's actually a pretty good question. My mother was a big fan of the VA, being a lifelong nurse there, and I think started in 1964. She unfortunately passed away the last summer, but it does seem to me like some veterans like it, some veterans don't. I don't know why public health care is what most people use, and why veterans can't use public health care and still have it paid for. Because to me, sometimes I think the VAs cost a lot of money. If you've been to any of the bigger VAs, it's a lot of land. It's a big physical plant. They usually were built in a sprawled out fashion, so very expensive to take care of, maintain, and manage. These little clinics should not be that expensive, but I don't understand why there has to be both. People may disagree with me on that, but I think it, you know, probably makes things more expensive. Whenever you get more government involvement, you get more expense, more bureaucracy.
So you've supported legislation improving veterans' health care across increasing transparency within the VA system. Does this situation highlight what you've been working towards?
We've just had the Tennessee veterans in my office and the VFW in my office this past week, and they had about 4 bills. I signed on to every one of them, which is typically what I do. Anything when it comes to improving veterans care. So, I'm not on the VA committee. I'm on the Armed Services Committee, and very appreciative of those men and women who are currently serving and all those who have served. And so, it's a top priority of mine to make sure that they're taken care of. And so any legislation that we can pass that makes their life easy, better, cheaper, and gives them what they promised or what they were promised when they signed up is what I aim to pass and support. And a lot of times, the government tends to break promises. I think TRICARE was supposed to have no co-pays for life. I believe that got changed. And so there's, constant changes within our government that is very frustrating to our veterans.
So, and you said obviously your priority is for this clinic to remain open.
Sure.
What steps are you able to take to try and ensure that this remains open?
Well, like I said, I want to have a direct conversation with Secretary Collins to see what the exact reason for the closure was. Was it because they were just unhappy with the current contractors, or if there's other reasons, if it was a cost cutting thing that was coming from higher up? I don't know the answer to that. Again, you saw I have a number of questions that I'm waiting for answers, but I would expect a direct conversation. And if it's simply a matter of finding new contractors, which is not always as easy as you'd think. There's physician shortage, especially in rural areas. In McMinnville, I don't know as rural as some of the other places in my district, but there just tends to be a physician shortage in general. And so finding quality physicians, nurse practitioners, physician assistants can be somewhat of a challenge, but we're willing to take on that challenge. And I'd like to work with him to see if there are other contractors out there that we could put in place instead of just shuttering something that the veterans have relied on for 16 years.
Well, you being an MD, you obviously know that there is a shortage of medical doctors in rural areas. And it is my understanding that this particular clinic was seeking a medical doctor to staff the clinic. And wouldn't it be an option to use a nurse practitioner instead of an MD at times?
Yeah, and I think that's very common. If you talk to veterans, I think you'll find a lot of them probably do see nurse practitioners or physician assistants. When I was with the VA back in the 90s in South Dakota, we had 2 physician assistants. They were great. They were good to work with, and they can see patients. I can oversee them. I think telehealth is an option for people. We kind of learned during COVID that you don't always have to go sit around and wait at a doctor's office to ask a question. When I first went to medical school, the dean of the med school said 80% of healing is psychological. So a lot of times people, get concerned about a sore throat. They look on the internet, they think the worst, but sometimes just talking to a doctor or a nurse practitioner and getting some reassurance goes a long ways.
Well, obviously, we don't have a lot of answers yet, and you have put the questions out there and are expecting responses. But um, have one of the questions I would like to know is why they are unable to staff this clinic.
Yeah, that's the question. Whether it's just shortage that they just simply can't find people. I mean, that's a possibility. But again, this is something that had they reached out in advance, and they admitted their mistake. They said that was wrong. We should have been in touch with you. We apologize. And so, they do understand that they kind of did this in a backwards fashion that didn't give us a chance to, possibly resolve the problem. So that's why I want to know whether this is something that's just simply about staffing or whether it's something about cutting and how many of these 1,300 plus facilities around the country could be facing the same fate. And, I think that's why it's important that I have a call, and I'm happy to do a follow up with you when I get more information because it's been, since I guess Friday or so since we learned this, and I reached out to the VA, and maybe I'll hear something today, maybe this afternoon, and I will certainly give you up any follow up information that I receive.
Excellent. Well, I truly appreciate you taking the time to talk to me. And if you had one last message to send to our veterans here in Warren County and surrounding areas, what would that message be?
Well, the message is number one, thank you for your service, and number two, I'm going to continue to fight to make sure that you get the best care possible. And whether that's at this clinic ultimately, or whether it's at local clinics, we want to make the transition smooth and acceptable to our veterans. And just know that I care deeply about you. And my son is went through the Naval Academy and the Marines. He's learning to fly C-130s down in Miramar right now, and I know a lot of his Marine friends that he's brought to the house, and it matters. These guys are willing to fight and die for our country, as we're seeing right now in this conflict in Iran, which I think strategically is incredibly important. And so we're just grateful that we have people that are willing to step up and do that to keep America free.
Well, Congressman, thank you so much for your time, and please tell your son thank you for his service as well. But we appreciate you fighting for our veterans here in Warren County, and thank you for talking to me and giving us. I know we don't have all the answers yet, but hopefully you'll get some soon.
Yeah, well, thanks for having me on. It's an issue that's obviously important to a lot of people. We're getting a lot of feedback, people reaching out, and so they're very concerned about this, and it's an issue that is clearly very important to them and to me and to you, and so we're gonna do the best we can.
Well, Congressman, we'd love to follow up, and thank you again.
Absolutely, thank you.
All right, bye.
Bye.